Key takeaways from the CNA Practice Exam Guide. The MCNA Practice Exam is your roadmap to success. It's not just a test, but a tool to assess your knowledge, identify weaknesses, and familiarize yourself with the actual certification exam format. The syllabus is comprehensive. It covers everything from basic nursing skills to resident care, legal and ethical considerations, common medical conditions, and emergency procedures. Effective study strategies are crucial. Active recall, spaced repetition, practice questions, and seeking additional resources are essential for mastering the material. Test anxiety is normal. Practice relaxation techniques, engage in positive self-talk, and ensure you're well-rested and prepared for the exam day. Continued learning is key. Stay up to date with advancements in healthcare, attend conferences, read professional journals, and seek mentorship to enhance your skills and knowledge. Let's delve deeper into some of these areas. 1. Basic nursing skills, infection control. This is a critical aspect of CNA practice. It's essential to understand the chain of infection, standard precautions like hand hygiene, isolation techniques, and proper disposal of contaminated materials. Think about how you would apply these principles in a real-world setting, such as when caring for a resident with a contagious illness. Vital signs, accurate measurement and recording of vital signs are fundamental. You should know the normal ranges for temperature, pulse, respiration, and blood pressure, as well as how to identify and report abnormal findings. Practice taking vital signs on a mannequin or a willing volunteer to gain confidence. Hygiene and grooming. Assisting residents with personal hygiene is a sensitive and important task. Remember to respect resident preferences, ensure privacy, and provide gentle and compassionate care. Pay attention to the specific needs of residents with different conditions, such as those with dementia or mobility limitations. 2. Resident care, nutrition and hydration. CNAs play a vital role in ensuring residents receive adequate nutrition and hydration. Understand the importance of a balanced diet, dietary modifications, and monitoring fluid intake and output. Be aware of signs of dehydration or malnutrition and report any concerns promptly. Communication. Effective communication is essential in healthcare. Practice using clear and concise language, active listening, and nonverbal communication techniques. Learn how to communicate effectively with residents who have communication impairments, such as those with dementia or hearing loss. Emotional and psychological support. CNAs provide emotional support and comfort to residents. Be empathetic, respectful, and understanding of their needs. Recognize signs of depression, anxiety, or other mental health issues and report them to the appropriate personnel. 3. Legal and ethical considerations. Resident rights. CNAs must be familiar with and uphold resident rights, including the right to privacy, confidentiality, and informed consent. Understand the legal implications of violating these rights and how to advocate for residents' best interests. Legal responsibilities. CNAs have legal responsibilities to report abuse, neglect, and exploitation. Know the reporting procedures in your state and how to document suspected cases of abuse. 4. Common medical conditions, cardiovascular conditions. Understand basic concepts of cardiovascular disease, such as heart attacks, strokes, and heart failure. Recognize signs and symptoms of these conditions and know how to provide immediate care, such as calling for help and monitoring vital signs. Respiratory conditions. Be familiar with common respiratory conditions like pneumonia, asthma, and COPD. Understand the signs and symptoms and how to provide appropriate care, such as assisting with breathing exercises, administering oxygen, and monitoring respiratory status. Diabetes. Know the basics of diabetes, including type 1 and type 2 diabetes. Recognize signs and symptoms of high and low blood sugar and how to assist residents with managing their diabetes, such as monitoring blood sugar levels and administering insulin. 5. Emergency procedures. CPR. CPR is a life-saving skill that all CNAs should be proficient in. Take a CPR certification course and practice regularly to ensure you are prepared to respond to emergencies. Heimlich maneuver. The Heimlich maneuver is used to dislodge food or objects from a choking person. Practice this maneuver on a mannequin or with a trained instructor. 6. Additional resources. Study guides. There are numerous study guides available, both in print and online, that cover the MCNA Practice Exam syllabus in detail. Look for guides that are updated regularly and provide practice questions and case studies. Online resources. Many websites offer free or paid resources for CNA exam preparation, including practice questions, quizzes, and video tutorials. Some popular websites include nurse.org, offers a free CNA practice exam and study guide. CNAprep.com provides comprehensive study materials, practice exams, and personalized study plans. Kaplan Nursing offers online courses and practice exams for CNA certification. CNA training programs. Enroll in a CNA training program to gain practical experience and hands-on skills. These programs typically include classroom instruction, clinical rotations, and a certification exam preparation component. Remember, the MCNA practice exam is a valuable tool for your success. Use it to assess your knowledge, identify areas for improvement, and build your confidence. With dedication, hard work, and a structured approach, you can achieve your goal of becoming a certified nursing assistant. Let's dive deeper into some specific areas you might find particularly helpful. 1. Beyond the basics, developing critical thinking skills. The MCNA practice exam doesn't just test your knowledge, it assesses your ability to apply that knowledge in real-world situations. This means developing critical thinking skills. Here's how to do that. Read between the lines. Practice. Exam questions often present scenarios, requiring you to analyze the information and draw conclusions. Don't just focus on the obvious. Look for subtle clues and underlying issues. Prioritize. In a healthcare setting, you'll often face multiple tasks and needs. Learn to prioritize tasks based on urgency and importance. Consider the potential consequences of not addressing a particular need promptly. Think like a nurse. Put yourself in the shoes of a CNA and imagine how you would respond to a situation. Consider the resident's perspective, their needs, and the potential risks involved. Question assumptions. Don't just accept information at face value. Ask yourself, why is this happening? What are the potential causes? What other factors might be involved? 2. The importance of documentation. Documentation is a crucial aspect of CNA practice. Accurate and complete documentation ensures continuity of care, helps prevent errors, and provides a legal record of care provided. Here's what you need to know. Charting basics. Learn the different types of documentation, such as flow sheets, progress notes, and medication records. Understand the purpose of each type of documentation and how to complete them accurately. Clarity and conciseness. Use clear and concise language when documenting. Avoid using jargon or medical terms that residents or their families might not understand. Objectivity. Document facts, not opinions. Avoid making subjective statements or interpretations. Focus on what you observed, measured, or did. Timeliness. Document care provided promptly and accurately. Late or incomplete documentation can lead to errors and misunderstandings. 3. Building communication skills. Effective communication is essential for providing safe and compassionate care. Here are some tips for improving your communication skills. Active listening. Pay attention to what residents are saying, both verbally and non-verbally. Use verbal and non-verbal cues to show that you are listening, such as making eye contact, nodding your head, and asking clarifying questions. Empathy and compassion. Show empathy for residents' feelings and concerns. Try to understand their perspective and offer support and encouragement. Clear and concise language. Use clear and concise language when communicating with residents, families, and other healthcare professionals. Avoid using jargon or medical terms that might not be understood. Cultural sensitivity. Be aware of cultural differences and ensure your communication is respectful of residents' beliefs and values. Respect for privacy. Maintain resident confidentiality and respect their privacy when communicating with others. 4. Understanding resident rights. CNAs have a legal and ethical responsibility to protect resident rights. Here are some key resident rights you should be familiar with. Right to privacy. Residents have the right to privacy in their personal care, including bathing, dressing, and toileting. Respect their privacy by knocking before entering their room, closing the door when providing care, and ensuring their belongings are handled with respect. Right to confidentiality. Residents have the right to confidentiality regarding their medical information and personal details. Never share this information with anyone who is not authorized to have it. Right to informed consent. Residents have the right to make informed decisions about their care. Explain procedures and treatments clearly and ensure they understand the risks and benefits before providing care. Right to refuse treatment. Residents have the right to refuse treatment, even if it is recommended by their doctor. Respect their decision and document it appropriately. Right to freedom from abuse and neglect. Residents have the right to be free from physical, emotional, sexual, or financial abuse and neglect. Report any suspected cases of abuse or neglect to the appropriate authorities. 5. The importance of continuing education. The healthcare field is constantly evolving, with new technologies, treatments, and best practices emerging regularly. Continuing education is essential for staying up to date and providing the best possible care to residents. Here are some ways to stay current. Attend conferences and workshops. Attend conferences and workshops related to CNA practice to learn about new developments, best practices, and emerging trends in healthcare. Read professional journals. Subscribe to professional journals and publications related to nursing and long-term care to stay current with research findings, clinical guidelines, and industry news. Seek mentorship. Connect with experienced CNAs or other healthcare professionals for guidance, support, and mentorship. Pursue further education. Consider pursuing further education, such as an associate's degree in nursing or a bachelor's degree in nursing, to expand your career opportunities and advance your skills. Remember, the MCNA practice exam is a stepping stone to a fulfilling career in healthcare. By understanding the syllabus, developing critical thinking skills, and committing to lifelong learning, you can achieve your goal of becoming a certified nursing assistant and make a positive impact on the lives of residents you care for.